we will be putting in place a national framework for circumstances where there are lockdowns imposed by state public health orders in areas that are defined as a Commonwealth hotspot by the Chief Medical Officer. Those arrangements will provide support for periods of time where the lockdown has been greater than 7 days. So the first 7 days, they are matters entirely for state and territory governments as they wish to provide support. If a lockdown as a result of a state public health order continues in an area that is also defined by the Chief Medical Officer of the Commonwealth, then we will be providing support for payments for those affected in those affected areas. Now, that could be a particular suburb defined by postcodes. It could be an entire metropolitan area, as is indeed the case in the Melbourne metropolitan area right now. Or, even more broadly, if the Chief Medical Officer was of the view that a hotspot encompassed an entire state jurisdiction. So the Commonwealth's decision to provide that support will be based on the medical advice received by the Chief Medical Officer of the Commonwealth, which is only reasonable, given that the Commonwealth has no part in the decisions made by state governments when they're coming to their view as to how they might impose their restrictions. Now, clearly, the Chief Medical Officer works closely with the Chief Health Officer of every state and territory jurisdiction and is in a position to fully understand the basis of decisions made at a state and territory level, and that can assist inform their decision. And it is indeed the case that the greater metropolitan area is a Commonwealth hotspot and is expected to be so over the next 7 days for the extended period that has been announced by the Victorian Premier. So what we'll be putting in place is what we are calling the temporary COVID disaster payment. The temporary COVID disaster payment is made on a week-by-week basis. It is using the disaster recovery payment framework, which I'll ask the Minister for Emergency Management to go into more detail on. That will be a payment of $500 for those who would ordinarily work more than 20 hours in a week, and $325 for those who would work less than 20 hours a week. It will be available to a person who is an Australian resident or a holder of a visa class permitted to work in Australia. The person is at least 17 years old. The period occurs from the date of activation for an area which has been locked down for more than 7 days. I should stress this is a similar arrangement that exists in New Zealand, where their payments for this type of support kick in after 7 days, not before. The person resides or works in the area defined as a Commonwealth-determined hotspot. The person was immediately prior to the state health order and Commonwealth-determined hotspot engaged in paid employment and is unable to attend work and therefore unable to earn an income as a result of state health restrictions. Now, you'll be aware that we already have a pandemic leave payment for people who are required to isolate for a 14-day period. And that could be because they are close contact testing or any number of other reasons that are determined by the state government. The person self-declares that they would normally have worked in the relevant period. The person self-declares a loss of income for the relevant period. The person will not be required to use annual leave, but must have sufficient and must have insufficient other appropriate leave entitlements, including special pandemic sick leave, and have exhausted those entitlements. So you don't have to get into your annual leave, but if your employer is already providing you leave for these types of purposes, then it's reasonable that people would use those in these circumstances. The person self-declares that they have liquid assets of less than $10,000. Remember, we're talking about someone getting through the next week who would ordinarily be in an economic situation where every dollar counts. Where those have independent means of supporting themselves for a week, then I think they would agree that reaching out for Commonwealth taxpayer funded assistance is not something they would consider reasonable for such a short period of time. The person must not be receiving an income support payment or pandemic payment. So if you're already receiving support through the social security system, you're on JobSeeker, remember where we've relaxed the rules around JobSeeker, well, you're getting your support through that channel. If you're already getting support through this channel is not available to you. And the person must accept and acknowledge that they meet the above criteria with the possibility of retrospective compliance activity, as you'd expect, as we apply in all of these circumstances.